Hi, I'm Dr. Sally Foote from Oak Veterinary Clinic, and I'm going to show you how, using the less stressful handling techniques, how we're going to do Jake's exam. This is Jake's first examination here with us. We've never met Jake before, and it's been a few years since he has been to the veterinarian. He's in his little soft-sided carrier, and his wonderful owner kind of tricked him into getting in the carrier by putting it on his favorite chair so he climbed in more easily. This really helps a lot for the cats coming in for exam if we can have our clients think of ways to make it less stressful to come in. So to start, we're going to leave him in the carrier. Mr. Jake, hi baby. I can see he's a black kitty. He's kind of hanging halfway back. His pupils are a little dilated because, you know, we're not the best place in the world for a cat to be. So to help him out, the towel here has already been sprayed with Feliway, but I'm going to spray myself. This is real important. On your forearms and on your smock, and your technician does the same, because that Feliway has what's called the Feline Friend pheromone in it. In other words, to the cat, they'll feel a little bit like, oh, I met you before. And that's real important. So I'm also going to be ready with a couple of our kitty treats here. And we've got our little treat smorgasbord with kitty treats and some of the liver paste.
That's okay.
Peanut butter, sorry.
Next one.
Over here.
Nope. Keep going. There you go.
Oh, down the one. Okay, so we preload our syringes with the liver paste by Kong, but anyway, we're ready with some rewards. So this way, if he's interested in eating, he's got something good happening from the start. So let's go ahead and get started here. So we'll just take and undo the carrier. And when we do, Mr. Jake, we're going to give him a second or two to see if he wants to come out on his own. And he really doesn't. Do not reach in the carrier. Real important. You'll trigger, that's very threatening to the cat. So what we're going to do is gently raise the back end. I call this the slow dump truck technique. So just like a dump truck, we're slowly raising it to encourage him to walk out. And even if you have to get this all the way up on the end, that is what you do, so he walks out voluntarily. And now Rachel here is only putting her hand on his shoulder as a means of restraint. Do not scruff the cat. It's also very upsetting to the cat. It can create a lot of pain. And then they associate horrible things with our hands being at the veterinarian. So now we have him out, and as she's touching and petting him, she's assessing his state of mind. He's relatively calm. He's a little bit uncertain, which is why he has his legs tucked up, but his ears are forward, and you can see he's looking around. We may offer him a little treat, which right now he may not be quite interested in eating, and that's okay. So I'm going to put a little bit on the scale, and now we'll go ahead and weigh him. So there we go. She'll just gently lift him, place him on the scale. You can even put a little treat or two on the scale. 11 pounds, 3 ounces. Okay. Now some cats like to lay on the scale, and that's fine. They can lay on the scale. You can do the examination on the scale. But we took him off, and he wants to come off. So I'm going to proceed on with the examination and tell you the order I do it. So I'm going to write down his weight. And really the first thing to do is the non-painful examination, meaning listen to their heart and lungs with the stethoscope, then palpate the abdomen, comb the fur, and the last thing you're going to examine are the ears, the eyes, and the head. You'll get everything checked as best you can depending on their state, and the whole time, with every touch, you're going to evaluate how this animal is responding to you. So, all Rachel needs to do, you see, is put some hands on him to prevent him from jumping forward. That's all she needs. If he was really hunkered down and hiding, we would cover his head with a towel, because he would be telling us, I want to hide. But with his head up, and he's actually pushing into her. You can see that as she's rubbing his neck, he's pushing into her as a way of saying, I like this, I want you to rub me more. And he's looking around, so he's actually going to be happier with his head out and his ability to see. So, and I do not need to put a hand on him, so I won't. If your hand's on the cat, the happier the cat. And you have a nice, normal heart. Yes, you do. Good. I'm going to listen to your tummy. It's always good to listen to the abdomen. How was your borborygmus today? Okay. I'll palpate your abdomen. Good. So I'm watching his body response as I do this touch. If he started flinching up, that may indicate pain. And I would say that's Rachel, but he's not. So I'm going to comb you through with the flea comb, because fleas have been a big problem in our community.
Mom says she gets crusties from up here.
Yeah,
she
we do get
comb at home.
Okay, so he's had some flea allergic dermatitis around his head and neck, but that's improving a lot. Oh, and now you're purring. Lymph nodes feel normal. Good. For examining the mouth in a cat, I like using a Q-tip. A Q-tip is soft, and this way we can prevent our hands getting in the head. I only support underneath the chin, and then we're going to raise the lip. There you go. And we can see the teeth and the gums, and even slip the Q-tip in between, look inside the mouth. Very good. If you really wanted to, you could cover it in something like food. So you can take that. Here you go. Okay. Now he's starting to become interested in eating because he's had enough time here to acclimate and be relaxed. Cats take longer to be interested in food. So food needs to be really interesting to them, and they take a little bit of time. So, hi you. I know, I'm going to look down there. Good boy. Nice one. Job. To the side. There you go. Just check your PLRs real quick. Oh, good. They're normal. Okay. So his physical examination is normal. We completed this in just a few minutes with very little stress and, frankly, very little restraint on him. And that's all you need to do. By following these steps, we can help our cats to have much better, more cat-friendly examinations for themselves. It makes it easier for the owner to bring the kitty in for care, for us to deliver care, and we can also still remain safe and prevent bites and scratches in the veterinary office. Thank you.